Ghana has only 9 years to ensure all citizens have access to high-quality healthcare as enshrined in the universal health coverage.
The President has a very clear vision of making healthcare accessible. For us to have universal health coverage by 2030, which is the goal, you need a lot of access.
And therefore, our health insurance that we established has become a major driving force to enable us achieve universal health coverage by 2030. Honestly, at international fora, wherever we go as a ministry to represent the country, everybody talks about our health insurance when it comes to health financing.
And the research gave us 2 reasons why they don't renew. One was just the difficulty. Transport, queuing at our offices, even though the card was instant, the delay. And we worked out that on average, people were claiming it takes 11 hours of queuing to get an NHIS card. Obviously, that had to stop.
This was clearly a disincentive for people to access healthcare, which is definitely a barrier to achieving the universal health coverage.
To say you've achieved UHC, 80% of your population must be covered. Currently, the kind of registered membership is around 78% of Ghanaians have a health insurance card with their biometrics captured. So we're getting there, but really it's about active membership, and that is where we're at 52%.
An innovative solution was therefore needed to fix this. Health Minister Agyapong says they had to take advantage of the Vice President's digitization drive.
Excellency Dr. Baumia declared the age of technology and digitization in our country. And it's like, let us look at our work systems and see how best we can digitize some areas that will make us achieve bigger outcomes for the mandate that we have been given. And so that put up. And health insurance are already digitized a lot. All our offices are linked to the center. And innovation and how we are processing our claims with technology gave us an edge over others to the extent that we can actually, through innovative thinking.
Digitization is needed more than ever in Ghana's healthcare delivery system. That's according to Dr. Selby.
The digitization drive is the step to the interventions that will change this country's health status.
For the Vice President, mobile renewal is the way out.
People used to come and sleep for 2-3 days from villages to before they could renew their national health insurance. But we said, listen, this can be done by mobile phone, right? Digitize the process, and anybody who wants to renew their national health insurance doesn't need to travel all the way to the district capital and sleep or bribe somebody to be able to get quick service or whatever. Just get onto your mobile phone, dial *929# and follow the prompts very quickly. Within a minute or 2, you would have paid for your national health insurance renewal.
After several fine-tuning, the decision was made to settle on the *929#. It worked like magic.
When we started, we picked a semi-urban area and a rural area. Let's try, see what happens, and then we can roll it out. People just spread the word across the country. And within a week, about 1,000 people a day were trying to renew from districts that were not opened up because only the pilot districts were working. And the pressure across the country to scale it up nationwide, we knew we had a good product.
A few years after the pilot, everyone had unfettered access to sitting in the comfort of their homes to renew their health insurance cards.
And to the extent that even now, when you go to a hospital, they prompt you to try to find out whether you can confirm the attendance that has been billed to health insurance, such that some accountability issue also has been introduced within the technology landscape to try to ensure that facilities don't send claims which are not correct. So you want patients to reconfirm the type of claims that hospitals are bringing to us.
You are seeing quite a lot of people actually and renewing their membership, and therefore we are expanding coverage in terms of people who are covered by national health insurance.
We were planning that by 2-3 years, about 50% would be renewing by mobile, and then we tried to grow it. Within 6 months, 75% were renewing by mobile, far above our expected. We didn't even have to spend that much money on marketing. It marketed itself, which is what happens when you have a good product.
Testimonies abound in the district on the comfort the mobile renewal has brought to clients of the scheme and staff of the National Health Insurance Authority. Menchia in the Ashanti region, Techiman in the Bono East region, and Walwale in the Northeast region district offices are among the top 5 district offices with the highest mobile renewals. We decide to visit these 3, and the Menchia district office is our first port of call. It is a very busy office and it is headed by Esther Odum.
For Menchia, I don't think this is, a busy atmosphere, because for us in our peak, you wouldn't even have a place to stand to put your cameras.
Before the inception of the mobile renewal, the staff here were always under pressure to meet the demands of the hundreds who throng here daily.
Before, we're managing the crowd. You have to do it, you have to come, you have to do it, and all. There are instances where somebody is sick in a hospital bed, they have to carry the person over simply because the card has to be renewed. But now it's not like that. Somebody stands somewhere and then does it. One person could even do it for a whole family, and I think that it's really easing the system.
The star 929 hash mobile renewal is really a game changer.
One main challenge of people was that I wouldn't want to go and queue just to renew. And since it came especially people with, the intellectuals who are in institutions. We do institution registration. Before you get there, they are done with their renewals. You only have just 1 or 2 that had problems and challenges with the system network, and then you just bring them over to the office to work for them. I think that is a great reliever.
And this relief is also felt by their clients. Akusua is one of them. Before the introduction of the star 929 hash, Akusua would travel long distances and even sleep over at district office for her turn to renew her card.
I think 2019, and I'm to say mobile renewal. If it's all, I'm buying on my chair, I'm happy. Card no so ya major cards na me ankasa me renew or phone somehow. Enti I say aboa me mama ntwa kwan sans sankra no family nana ne me mama be delights metna ha sa. E mama timi koye madwuma baby amiti bia mitimi ye e mama nti eye pa.
Whatever time that you want to renew, once you dial star 929 hash on any mobile phone at all, it could be a young phone, it can even be a cassava phone, it will still work.
This is a homegrown solution. Cost very little money. Didn't have to sign £80 million contract with anybody. And look at the difference it has made to all of us.
In Techiman in the Bono East region, before the introduction of the star 929 hash, this district office was always congested. A mixture of old clients wanting to renew their cards and new persons trying to sign up.
You come and find so many crowds in the office. All around the office, people were around trying to get their membership renewed. And then it created a lot of inconvenience on our limited resources here. You could come and see rubbish scattered all over the places.
Some unfortunate incident happened right here.
We had a situation where a pregnant woman came, in the course of waiting, she had to deliver in this office. Really? Yes. Because the crowd were many and it's a process.
For the number of years, long queues continued to form right inside and outside of this office. Some crimes were perpetuated.
People were also taking advantage of these innocent clients and extorting money from them. So some of the members were paying unauthorized fees to certain people who were by then serving as middlemen because they happened to know some of the workers who were processing the ID cards. So they were trying to assist them, taking some fees or charges from these innocent members.
These are some of the reasons people who had the National Health Insurance cards were demotivated to renew when they expire.
3 days, 4 days. Kwanya yisi faso ateti aye famu ewo ha ansan o mo ri ni amaye no enye easy nipa na ye gu office ha no na enye easy kura but ene no enti say.
But the story drastically changed when the digital platform was activated.
Na wu na minim ikoduri ye no omo eji ma yini shemu a omo check ma am no so insurance na wu mi gina hwa na mi bisa ma ne say na meet ma renew no so wu ska wo ho a bit ma renew ma mi ska mo renew no ha ma me omo renew ma me no mi gina hwa nso so e dey ko hospital e ma doctor hwe me nti mobile ayini de aba be boaye timamfo ya yifire chiri e ba no aboaye because of say lo fe kra na nka obetua odi aba ha no na enya de keto.
Government says it got it right, as this technology and the many others they have introduced are lessening the burden of Ghanaians.
At the end of the day, life is very important. The president tells us that we know how to bring back the economy, but we don't know how to bring back a life once you've lost it. And so the government cares very, very strongly about the lives of Ghanaians and our ability to access good health care. Right, and so this is why all these things are being done across the spectrum, and this is what we are trying to do to improve healthcare.
We thank the Vice President for his support all the way through. He kept encouraging and pushing us, and it's really the start of a big digital push in this country.
Wali Wali in the West Mampusi district of the Northeast region was among the few districts in the country this mobile renewal was piloted. It is another busy NHIS district office. Service delivery was worse prior to the inception of the star 929 hash.
As you can see from the background, you see a lot of clients around. These are just people who are here to register, not to renew. New clients. So you can imagine what would have happened if about, let's say, 200 people a day will come to add up to this number. You can imagine what will happen. So I can say that the system has been a savior. That is, the mobile application system has been a savior because it has actually decongested our office. Because in a day, let's say daily, we can have like 200 people renewing via mobile money. So if these people are to add up to those who are to do the fresh, you can imagine the chaos that will go through here.
At the National Health Insurance Authority headquarters, one thing excites them most: how revenue leakages have been blocked, courtesy the mobile renewal.
Obviously, with no cash changing hands anywhere, revenue leakages dropped. The temptation for malfeasance at our district office all went away. There are some districts where 90% of the renewals are by mobile money. So it has made a big difference. Second thing is not needing to go to the office to print. On the back of the cards, the ribbons, buying printers and all that, drastically reduced. So that is saving us some revenue.
This is not the only action government is taking to protect Ghanaians through digitization.
We will see a modernization of Ghana, as the President Nana Akufo-Addo has asked us to do.
pour mon pays de Ghana. One love pour nos mamans Africa. Kumasi or Sacrum Charlie. Je vais depuis que je suis môme, c'est Waté. Oh, and you m'aide à bas. Et c'est même pas du Azonto, c'est ça.